March is Colorectal Cancer Awareness Month.
And new research shows that only 63% of adults ages 45 to 64 actually report being up to date with all of their screenings. And now we're learning of a blood test screening option that could actually help encourage more and more people to get screened. Joining us now is Victoria Raymond, Senior Director of Medical Affairs at Guardant Health. Good morning to you, Victoria. Thank you so much for being here with us.
Good morning. Thank you for having me.
Tell us a little bit about this new screening.
Yes, so we know that colorectal cancer screening can save lives. And that's especially important for the residents of the Detroit area because we know that in Michigan, there will be more than 4,500 new cases of colorectal cancer diagnosed this year alone. And we know that it's really important to detect colon cancer early because when it's caught early, it is treatable. The percentage of people that are up to date, that are alive after 5 years after their colon cancer diagnosis, when it's diagnosed early at stage 1, is 91%. If we wait too long and we catch colon cancer too late, we know that that number can decrease down to 14%. So it's absolutely critical that we're detecting colon cancer early. And we know that there are many colorectal cancer screening options that are available today, but as you mentioned, people are just not doing them. Nearly 1 in 3 eligible Americans are not up to date with colon cancer screening. That's 50 million people that are not getting screened today, and we really wanted to understand why.
Victoria, I feel like there's been a push, probably in the last maybe 5 or 10 years, for colorectal cancer. Why do you think that is? Why the change in making sure that this cancer maybe is more at the top of people's agendas to get the money and to get the help it needs to either developing some sort of cure or getting early detection?
Yes. So we know that there's been that push because, as I mentioned, we really can understand that people do better and can survive their colon cancer when it's detected early. And there's many screening options, but in the survey that we just commissioned, we found that the barriers to completing colorectal cancer screening were primarily twofold. Number one, people thought the current options for colon cancer screening were unpleasant, and also people were worried that the current options for colorectal cancer screening might induce some discomfort. And so we really sought to understand if people would be more interested in completing colorectal cancer screening if there were a blood-based test option. And interestingly, from our research, we found that 90% of surveyed Americans would be likely to complete their colorectal cancer screening if a blood-based test option were available. So very exciting.
You know, what's interesting, too, as we see the age numbers changing, right? Getting younger and younger in terms of recommended screenings. Where should folks start, Victoria, if you've never had any sort of screening? What do you ask your doctor?
So if you are age 45 or older or approaching that 45th birthday, please talk to your doctor about colorectal cancer screening options that may be best for you. And please be on the lookout for our blood-based test from Guardant Health called Shield that should be FDA approved this year.
Are people a fan of those blood tests between doctors and patients? Is that maybe going to be the mainstream route here pretty soon?
Well, what we found from our survey, so we surveyed about 1,000 U.S. Americans, about 250 primary care providers, and about 100 gastroenterologists. And about 90% of those surveyed Americans said they'd be willing to complete colorectal cancer screening if a blood-based option were available. And interestingly, over 96% of primary care providers said they would recommend an FDA-approved blood-based test for colorectal cancer screening if it were available.
Okay, Victoria, thank you very much. That's Victoria Raymond with Guardant Health, as March is Colorectal Cancer Awareness Month. Thank you very much, Victoria.
Thank you for having me.